typically given abdominally. 2B syringe, which is the brown cap, it can also be used for other medications that are given in very small doses. This typically is injected as a, sorry, I've lost my train of thought, as an intradermal injection, please forgive me. And it's typically given in the forearm with the needle, the bevel up, and it's just going to kind of bubble the skin a little bit. It's given at a 15-degree angle. Our IM injections typically come with a 3 milliliter, 5 milliliter syringe. The higher the needle gauge, the smaller the needle. So this one actually is a 3 milliliter 22 gauge needle. I'm going to be drawing up 3 milliliters worth of a medication. But before I do that, I want to look at my MAR. I want to make sure that my patient doesn't have any allergies. I'm going to look at the medication name. I'm going to pull it out of the Pyxis or whatever system that they have. I'm going to go through my 11 rights of medication to make sure it makes sense as to why this patient is receiving it. It wouldn't react with anything else that they have received, just to make sure there are no mistakes or nothing overlooked. I would get my medication. I have an alcohol swab. I want to clean the top of that medication really well. So if the medication has been ordered for 3 milliliters, I want to draw back 3 milliliters worth of air. My medication is sitting flat on a stable surface. I want to inject that 3 milliliters of air into my medication vial. And then I just want to invert it. And I want to draw back my 3 milliliters worth of air. I want to make sure, once I cap it here, I want to make sure that this internal part of the plunger is not touched because it needs to remain as a sterile system. Once I have the medication drawn up, I can then label it with the patient's name, date of birth, and what this medication is so that it doesn't get lost in transit or mistakenly give to someone else. With this remaining sterile, I want to just remove my gloves, go down to the patient's room. I want to, once again, I'll perform hand hygiene, of course. I want to identify my patient with 2 identifiers and check their armband. I also want to ask them once again, do they have any allergies that they're aware of, just to make sure. I'm going to explain to them what medication they are receiving or what it's for, answer any questions that they may have. Now, with an IM injection, up to 1 milliliter can be given in the deltoid. Anything over 1 milliliter needs to be given in the vastus lateralis. If it's over 3 milliliters, then it needs to be divided into multiple doses. Now, since we're only injecting 3 milliliters today, I'm going to do that in the vastus lateralis, and you find that by placing the palm of your hand on the greater trochanter and your thumb pointing towards the pelvis. I'm going to make a V, and that medication is going to be inserted right between that V. Before I insert that medication, I want to clean the area. I want to prep it with alcohol as well. I want to have gauze or alcohol swab handy in case there's any kind of bleeding after the injection is given. I just want to clean that up. Once again, answer any questions they may have, put the bed back down, just make them comfortable. I also want to update my MAR. I want to initial under the date that day is and the time that I have given that medication. I want to make sure that on the back of my MAR, I sign it with my full name, and then I want to add any PRN medications that were given on the back of this as well. At the top is the place for our vitals. Before giving a medication, we want to make sure that we assess those vitals, especially if we're giving a pain medicine or something for nausea, anything like that. But those vitals need to be recorded before the medication given. And then I'm going to come back and check on that patient once again in about 45 minutes and just recheck those vital signs or that pain scale. And I want to record that at the top as well. Our PRN medications, if they're written on the back, it also wants to know why we're giving it and evaluate after we've given it. So if it's a pain medication, I want to put patient complains of pain 8 out of 10. And then 45 minutes later, I want to come back in and reassess them and put their new pain level. I want to make sure that my signature is on the back so that they are able to realize who has initialed it on the front. I want to perform hand hygiene. I want to make sure that my needle is placed into the Sharps device, the Sharps container in the room.